Healthcare professionals are required to operate in accordance with protocols, clinical guidelines, and professional standards. Paramedics are also required to make decisions outside of these specific frameworks, and therefore the clinician must use their own discretion considering the legal and ethical implications of these decisions. Maxine, having just returned from maternity leave, has caused a motor vehicle accident en route to a paediatric arrest. As a result, 2 people have potentially been injured, and Maxine has had to make a decision whether to continue on to the original case or stop to help those injured in the road accident. Maxine's decision to stop can be justified through a deontological framework. Deontological ethics state that there are moral rules and duties which must be obeyed regardless of consequences. According to the Transport Operations Act 1995, drivers involved in an incident must immediately stop and provide necessary assistance. Maxine has acknowledged this moral obligation and stopped to provide medical care. Had Maxine left the scene to attend the original case, she would have contravened this rule and hence been unethical. Consequentialist ethics further justify Maxine's decision to stop at the road crash. Consequentialist ethics seek to maximize happiness, therefore the greatest good for the greatest number. In this case, 2 patients presented as a result of the accident while only travelling to 1 patient. At this stage, the status of the supposed paediatric arrest was unknown. Perhaps there was a miscommunication and the infant was not actually arresting. And if in fact the infant was arresting, it was also unknown as to whether Max and Maxine would have been able to successfully resuscitate. However, at the scene of the accident there was evidence of a life-threatening, yet with medical treatment, survivable injury. Therefore, Maxine's decision to stay and assist the mother and child at the scene of the accident ensured that 2 lives were saved. To remain at the scene of the accident is congruent with the bioethical principles of beneficence and justice. Maxine recognised her duty as a healthcare practitioner to benefit others and therefore stayed at the scene to treat those involved in the accident. Additionally, she upheld the principle of justice, which states that all individuals are equal. She therefore recognised that both the lives of the original child and the driver were of equal value. Therefore, she treated those involved in the accident as they were in closer proximity.